You have heard earlier about the ketogenic diet, which is used in uncontrolled epilepsy and began in the 1930s. You also heard how we can now use it in cancer and autism and Alzheimer's. But now let's go to something very different. Something that's not too common in India, that is multiple sclerosis. So what is this? This is a condition where there are episodes of weakness or numbness on one side of the body, sometimes a difficulty in speech, which comes on very acutely, usually begins at a young age, and it improves. With medication, it improves slightly faster, but even without medication, they improve. And there are multiple such episodes. So this is known as multiple sclerosis because it affects the white matter of the brain. It affects the myelin, like that is the sheath around the nerve fibers in the brain. So it's called as a demyelinating disorder. And this is known as the relapsing, remitting multiple sclerosis because it relapses and it remits. Now, all this time we have thought that this was due to an autoimmune problem, that there is some immunological mechanism, there's some antigen which gets into us, which causes an antibody reaction, which then goes and affects the CNS, that is the brain. However, it is found that about 85% of those with relapsing, remitting multiple sclerosis will ultimately go into what is known as secondary progressive multiple sclerosis. That is, they won't have these episodes, they'll go on deteriorating gradually. 15% of the others who don't get relapsing remitting type can get primary progressive multiple sclerosis. In these two, as yet there is no known treatment at all. They will continuously go downhill. So it has been found that this is different from the relapsing remitting type in that there is neurodegeneration, the degeneration of the CNS. And now it is felt that maybe even the relapsing remitting, the neurodegeneration comes first, gets out of the CNS, causes an antibody reaction with an antigen, it acts as an antigen, and then reattacks the CNS. So if we can target the neurodegeneration, we would be able to help these people, which is exactly what we did. So how do we do that? To target neurodegeneration, you have to target three things. You have to give the brain cells more energy, number one. Number two, you have to protect the neurons which are there and see that they don't degenerate. And the third and the most important is that the mitochondria which are abnormal, you got to improve them. All three of these are uniquely done by ketones. And where does ketones come? From fat. So once again, a high fat, low carbohydrate diet can help these patients with progressive MS. We have tried it out. This may be one of the first trials in the world that have been done on progressive MS. We tried it out on one with secondary progressive MS and one with primary progressive. Now the secondary progressive MS could walk only 12 to 13 meters at a time, and then he would have to stop. And he needed a walking aid. Now after he came on this diet, that improved from 12 to 13 meters to now 100 to 130 meters. And even more surprising, he could not hold his urine for more than 2 to 3 minutes. When he felt the urge, he would have to pass urine. And he is a nationally renowned specialist in tax. And he used to be invited all over India. He was scared to go to meetings because he knew that if he wants to pass urine, he would have to get to bathroom within 2 to 3 minutes. And with his the ability to walk, he would pass urine in his pants. And this is very embarrassing. Today, he can hold his urine for 30 minutes to 1 hour. So he's improved so much. Of course, he will be on the diet for a long, long time. But this diet is safe. It does not, though it is high fat, you do not put on weight. It's high fat, but your blood lipids won't go up. And there are no major known side effects. The other girl who is in a wheelchair has primary progressive MS, and even she has already begun improving. Of course, she's had primary progressive MS and been in a wheelchair for many years. So it's going to take us much more time to get her on her feet. And I hope that very soon, maybe in the next 6 months, I will be able to show you a video of this lady walking. So this is the only treatment that will help in progressive MS, and therefore I urge all of you to, if you have anyone who has this, to please send them to a center which uses the ketogenic diet. I thank you very much.